Okay, perfect. So another thing that I uncovered, with your memory loss, Julie, that the there's a mucus membrane, and even though I'm seeing the mucus on the brain, there is there's a source of it. I feel we need to get to the source. There's a source that where it all formed. It's like I'm feeling some sort of mutation. This is kind of, I don't know, it's like gene mutation, some sort of mutation, but there's a source of the mucus and it's being reinforced through the diet. I really would not have the cheese, the eggs, the meat. I mean, I would really lean into the fruits and vegetables more. Yeah,
What about seafood?
no.
Not feeling seafood right now either.
Nothing. This is a huge issue. What I mean is this is what has your diet has reinforced this and it's causing
Mhm.
mucus and a lot of mucus on your brain. It's covering up your brain. That's why you're not remembering. I mean, honestly, this is not even a hard now that I've had some time and I'm feeling the energy of what I'm saying, it's not really a hard case to crack. Your diet can greatly help this. We're going to go in and do some work today of looking into the mucus. Yes, yes.
What about bone broth?
Oh, sure. I mean, bone broth is nice. I like bone broth with a lot of vegetables instead of putting the meats in there when you go to eat it, right? After you
That's right.
clarify the bone broth. Yeah, just load it with, vegetables, broccoli, cabbage, carrots. Wonderful. Wonderful.
Yeah, I have changed my diet, since I talked to Tahira. It's been probably 3 or 4 days. I do feel slightly different. I don't feel like I'm so brain fogged,
Perfect.
you know.
Perfect.
So it,
Perfect.
That's beautiful
Good.
because it's
Good.
the main and Spirit wants me to stress this to you. Even though things can happen in our genes, we reinforce it by our
Mhm.
lifestyle. And so if you just keep
Yeah.
at changing your diet, and for you, I'm actually seeing more veggies than fruit. The broths are good too. But a lot of, cruciferous vegetables, a lot,
Mm-hmm.
that's what I'm seeing. I feel as if it's going to feed your brain.
Mm-hmm.
And this mucus, you may need to take some sort of herbs. Um, I'm not sure exactly what resource you can get, but they are, naturopath doctors and I don't know if you heard of Dr. Sabi, but he's, no longer with us, God bless his soul, but I do know he spoke a lot about the mucous membrane and he has a facility down in Honduras where people go and they stay there and he can do, they still run it. It's called the Ushu Village, I believe, Usha Village, in Honduras. You can go and stay there, and I believe that would be a really good treatment place for you. I'm not exactly sure since he's passed away. I do know like some members of his family are still running it, but he has laid the blueprint. And some people are saying, oh, it's not the same since Dr. Sabian, they've infiltrated him, but people are still going for healing and people are still having a lot of results. So I would look into going there because they put you on a diet there. They give you the herbs. You need herbs. This mucous membrane is festering, it's growing with every bit of meat that you give it, and sugar and bread and, wheat. It's growing, but they really, they remove that your diet. It's really just the fruits and vegetables and the herbs, and then they have a lot of other natural healing things there. So I you might want to look into that because I do believe this is something that can be healed, right? The next thing I got is an attack, as like a spiritual attack. She's being locked out of her consciousness,
Mm-hmm.
Kiahe, which actually goes directly to the what I was talking about, the ancestral block, conscious block,
Mm-hmm.
something ancestral, but her specifically, she's being locked out of her consciousness because I don't feel that they want her to remember because they don't want her to heal this in the bloodline. Um, the next thing I got from our first session together, the neck arteries are not carrying information to the brain. And you might know more about this than me, but I was feeling some energy in the neck, how, you know, how your body will carry information to your brain. And, you know, there's this really good book called The Body Keeps the Score. Julie, it talks about how the subconscious mind is actually located in our body, because our body is like a own biofeedback system, giving information, you know, to your brain and different parts of the body, just explaining, you know, to your whole entire system what's going on with you. But your body, aka subconscious mind, it's not able to funnel those messages up to the conscious part that you're using, right? So you're constantly living in the unconscious mind, you know, because you're not, the something in the neck, the arteries in the neck are not able to carry the information up. So everything still gets stuck. So that's another message that was coming through. And the last one was I was getting zombie genes. I do know that zombie genes, I mean, I guess I could look it up. It's a real thing. I've heard of it before, but I think there's a lot of zombie genes that she has that maybe are too many of them are being expressed, reinforced by the diet. And the zombie genes just make you tired all day, because that's probably a lot where the brain fog is coming in. Just because that's what it literally just makes you like a zombie. There's too many of those being expressed. So yeah, main takeaway is your diet, right? But I do want to check a little deeper into a lot of this. Yeah.
Thank you. Thank you for sharing that. Okay.
Yeah. Okay, do you have any questions at the moment, Julie?
I forgot. I thought I had one, but I forgot.
It's okay.
Oh,
And
Dr. Davy, right? I think I just bought sea moss kind of gel. Does he sell emphasize, sea moss gel? I
yeah,
think maybe he's
yep.
the one.
Yep, he's the one. He sells all that, and his herbs are, I mean, they're quite, you know, they're pricey, but they're not, I mean, they're not crazy, but they are pricey, but because you need a lot of herbs and an alkaline diet. Alkaline. So
Sea
he
moss,
actually,
right?
yeah, and he has a food chart. Like if you Google Dr. Sadie's food
Okay.
list, his alkaline list will come up and it'll tell you the foods that are acceptable on that list. That's what I'm seeing that would be really good for you. So let's go in and take a look, Kiahe, and kind of do a scan and kind of feel around and see where we can start. Yeah. Okay, Julie, what we're gonna do is we're all just gonna relax. We're gonna just center our breath and get really calm here. I want you to take a very deep breath in, moving that energy all the way up, hovering it over the crown chakra, kind of bringing it towards the front of your head, where I feel that the mucus membrane is. And I want you to move this energy. And when you take the breath out on the exhale, we want to breathe out in front of your head about 3 inches, right? 5, deeper, 4, deeper, 3, 2, 1, and relax. Another deep breath in, would you please? Moving this energy all the way up, raising the frequency, hovering over our crown, washing the energy down the front of us. 5, deeper, 4, deeper, 3, deeper, 2, deeper, 1. Very good. And just go ahead and take another deep breath in, would you please? Moving this energy all the way up, all the way up. And just relaxing those shoulders, very relaxed now, very, very relaxed. Very good. Okay, and just go ahead and close your eyes if you would, please. Okay. Mukireke nireke, nireke bureke, nireke, nireke, mureke nakireke, nakireke, nireke bureke, bureke nareke, mureke nakireke, nakireke, nireke bureke. nikireki, mureki, nareki, nireki, mureki, nakireki, nakireki, nireki, nikireki, nireki, nireki, bareki, nereki, bureki, dareki, direki, nareki, bureki, nireki, bareki, nireki, nireki, nareki, nikireki, nireki, bukereki, mukireki, nireki, nireki, nikireki, mureki, nareki, mureki, nireki, bureki, nireki, nireki, bureki, nireki, nireki, bureki, nireki, nareki, bureki, nireki, bureki, nireki, nareki, nareki, bureki, nireki, 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 na, nireki, mureki, mureki, nireki, nireki, bureki, nireki, nikireki, nireki, mureki, nireki, nireki, bureki, mureki, narkireki, nireki, bureki, bureki, nareki, nireki, nareki, nireki, murkireki, nireki, nireki, bureki, bureki, nireki, nareki, bureki, nikireki, nireki, mureki, 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 nireki, 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 bureki, mureki, nireki, nireki, bureki, nareki, nikireki, nireki, nireki, mureki, nireki, nireki, mureki, nareki, nireki, nireki, nikireki, nireki, bureki, mukireki, nireki, mukireki, mukireki, nireki, nireki, bureki, nireki, nikireki, nireki, mukireki, nireki, bureki, nireki, mukireki, nikireki, nareki, nireki, bukireki, nireki, nikireki, mureki, nareki, nareki, nikireki, nareki, mureki, nareki, mireki, nareki, nireki, 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 nareki, nireki, bureki, bureki, nireki, nireki, mureki, nakireki, mukireki, nireki, mureki, nireki, 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 direki, nareki, nireki, mureki, nireki, nareki, bureki, nareki, nikireki, mukireki, nireki, nikireki, nireki, mureki, nireki, nareki, nareki, nireki, nikireki, nireki, mukireki, nireki, nikireki, nireki, nikireki, nikireki, nareki, mireki. Can I get your feedback, Kiahe? What are you feeling anything yet?
Oh, it's just black. It's just a block.
Yeah. I'm sensing some things going on in the eye area. Um, and I was being drawn there last time too. Are you nearsighted or farsighted, Julie?
Originally, I'm nearsighted, but in college, my mom had me done this surgery. Like Russian doctor come to China, use knife to cut your eyeball. So you have my eye correction, but that was not very, because technology not like laser these days, so not very good. I had probably good eyesight for 15-20 years, and 10 years ago started getting really bad. Right now, my eyesight cannot be totally corrected by my lens glasses, so just not having a good eyesight.
Oh, I
Now it's
understand.
a
This
little bit
is
far sighted. Yeah.
far. Okay. This is kind of what I'm picking up as when I was doodling, I was just drawing like little this. I was like, what is that? It's a body part. At first I thought it was like under the breast, because like our bras kind of make that kind of, but it's under the eye. I kept drawing that, something under here. And then when I was here, focusing the energy on here, and I was starting to pull something, it was like there was something in there, and I saw a long rod, like a long metal rod coming out. But I noticed as I got further away, it kind of intensified. That's why I was like, so you were originally nearsighted. So when I got here, the far sight, the pain of getting this rod out intensified. And so if you went, you said that they did an eye surgery. Did they use some sort of long instrument at all? Some sort of metal instrument with the eye?
Knife. They numb
Knife.
your knife and they numb your eye. They use knife to cut it. These days they do laser. Back 30 years ago, the Russian doctor, use a knife to cut your eyeball. So
Yeah.
the way the focus will change. That's how they do. Not very accurate. That's why a lot of people, they become farsighted. I didn't become farsighted until later in my life, getting old, menopause.
Yeah. This is, I'm seeing it's a huge source of what's going on. Started in the eyes, and there was a film over your eyes. And I think that's also too what I'm feeling, the block out of consciousness, because I'm getting your eyes are a filtration system. This is what source is saying. Your eyes are a filtration system. It's not able to filtrate. Think about it. Just like we filtrate so many things. You know what? When a person, and I'm not saying you're blind, but when a person is blind, if they can't use their eyes, another one of their senses gets heightened. But because you're not blind, but there's a film over your eyes kind of stopping you, I do feel that all that information that's supposed to be filtrating, it's becoming that, bringing that mucus membrane, that you have the mucus here still over your eyes too. It's brain, but it's here in the eyes. And now I'm almost thinking that this surgery, how long ago was the surgery?
30 years ago. So that's one thing I'm going to ask you. I told my
Okay.
daughter not to do laser surgery because I don't feel this kind of surgery is really help. But she, against my will, she did it. So maybe she'll experience the same thing I did. When you have something surgery, even if it's laser surgery, doing something on top of the eye that damage the filtration, right? That probably can mess up more things later in life. Am I right?
I mean, it appears that this is what's going on with you. I want to dig deeper. Laser might be a little different. That might be, we know that that's a little safer. So, we hope that that doesn't happen for her. But I'm really concerned about I'm seeing something metal in your eyes, and that was the catalyst because you've had your memory loss for almost 30 years too, right? So this,
When they had after they had the surgery, right now if a doctor look into my eye with a device, they can tell I still can, like watermelon cut, you still can see the cut still there.
yeah. Okay. Thank you for
I haven't
sharing
heard
that.
of this procedure before. Have you, Tahira?
No, I've never heard of this. No.
RK, I think they call it RK. It's very,
RK?
it's something. It's yeah,
Mm.
it's before laser. It's the same theory, but device they just use a little tiny knife, like cut part of the water eyeball. So the focus, just a lens, change the lens, focus. So that change your eyesight.
Yeah.
I think they call it RK. I'm not sure. Very old. I can,
Okay.
Google and find out more
Yeah.
information.
No worries. We'll do
No,
that
that's
for you.
okay. Yeah. This is and then I guess now I just need to talk myself through it. That's kind of the source is what I'm seeing of the memory loss. But then also too, like I keep saying, that the diet is not making it any better. It's so it's not filtrating. So all that mucus, and that mucus, it's not just from physical, a physical byproduct, of like what we're eating. it's also to information that's supposed to be circulating and filtrating, because now you have two blockages, one here in the eyes and the other one not bringing information to the neck. So it's like you're kind of cut off from keeping your body in a homeostasis, you know, because there's some, but this eyes is a huge source. So I just want to dig a little deeper here in that. That could also be the neck. That could also be why the neck is not connected. It could all be just connected as well. Okay, while she's looking into that,
Yeah, there's some I was just looking at some side effects. Dry eyes, double or triple vision, fluctuations in vision quality, halos, glare, reduced indoor or night vision, even depression, corneal scarring, irregular. These are just some side effects that could come, but I don't see anything to do with memory loss, but she may have maybe a trauma. Maybe she experienced
yeah.
trauma, but basically it's a surgeon makes a small but deep incision in the cornea with the goal of flattening it. Since myopia often results from an excessive curvature of the cornea, this procedure will ideally help to reduce issues like nearsightedness and astigmatism.
Curvature. That's
Okay.
interesting, because this is
The curvature.
this is what I keep here.
Excessive curvature. Since, yeah, it says myopia often results from an excessive curvature of the cornea.
You see this, Kiahe?
Mm-hmm.
This is what I just kept
Mm-hmm.
drawing,
Yep.
like
Yeah.
here under the
Yep.
eyes, curvature.
Mm-hmm. Mm-hmm.
Maybe he did something wrong in the, I mean, obviously he did something wrong in the process.
It was so
Yeah.
pioneered, you know, not many people doing that. So
And it says many RK patients suffer from permanent vision damage and other long-term complications. The complications include weakened corneas, cornea incision done during RK heal in the wake of the surgery, but those sections of the cornea never regain their full strength.
so I'm a messed up.
No. I mean, no, don't say that. Something went wrong in that surgery. Whatever my intention is right there. It was the essence, it's like the essence of the surgery is still going on. It didn't like, there has to be something deeper. Do you feel what I'm saying? It's not the fact that, okay, the surgery happened, but the essence of the surgery is still, the energy of that surgery is still there. Now I'm wondering why. Why is the essence of the surgery still there, still with her? Is it because she can't filtrate it out? But this happened so long ago. I don't know why that would be there still. And we have to like play devil's advocate and connect everything, because if what I was picking up on about the ancestral blocking of her consciousness, like she's being locked out of her consciousness, if this is something ancestral, they will use, as we found out with the kidney, the lady who had the kidney, they will use any way, especially when you go in for surgery, they will use any way to still kind of control. You know, so I don't know that. I'm just this right here, what I'm saying is just something else I want to take a look into, because you can't just rule out anything. You know, in these situations, anything may be possible.
Yeah, and my nose is getting really like irritated right now too. So just all of a sudden my nose is just like stimulated.
I always have very bad allergy, seasoning
Mm-hmm.
allergy, and also like cat allergic to cat. But you know,
Mm-hmm. Yeah,
my
it's
nose
an
can be
allergy.
very itchy. Even I'm not experiencing right now, but it's very common for me to have itchy nose, itchy
Mm-hmm.
eyes. You know,
Mm-hmm.
itchy eye pretty much an everyday thing. Watery eye, you know, it's just like itchy
Yeah,
everywhere.
I'm actually clogged up right now. I'm just like really clogged in this area. And that is definitely, I'm gonna start there. I think I'm gonna
Okay.
go through
All
this
right.
area and check here.
Okay, perfect. So we're gonna go in for another layering here. Julie,
Okay.
right?
Just try to close my curtain.
Okay, no worries. And just go ahead and you have back pain too, right? You have back pain? Yeah.
Neck
just
pain, shoulder pain.
Yeah, yeah,
Neck
it's all
pain.
connected. I'm almost feeling like it's all connected with the eyes. The eyes is the source, you know? Um, and that's already been proven because 30 years ago you had this, and then about 29 years ago you started experiencing your memory loss stemming from the surgery. Okay, let's go ahead and take a deep breath in, would you please? Moving that energy up, hovering it over the crown chakra. And we really want to focus on bringing this energy down behind the eyes. So we're going to wash it over our scalp. Relax at 5. Bring it down over the forehead, relaxing at 4 deeper. Wash this energy down. Bring your awareness under the eyes and just stay there. 3 deeper. 2 deepest. 1 10,000 times deeper. And relax. Mukireki, nireki. Nireki, mareki. Mareki, bureki. Bureki, nireki, nareki. Nareki, bureki, nakireki, nakireki, nireki. Nireki, bureki, nareki, bureki. Bureki, nareki, nareki. Nareki, nareki, bureki. Bureki, nireki. Nikireki, nireki. Nikireki. Nireki, bareki. Bareke, narere. Nireki, bureki. Mureki. Mureki. Mureki, nareki. Nireki, nireki. Nareki. Bureki. Nikireki, bureki. Nikireki, re, re. Dere, de, dere, de. Mureki. Nikireki. Nireki, bureki. Mareki, nareki. Nireki, bureki. Mikireki. Mireki, na. Nikireki, nireki. Nikireki. Mureki, nareki, nireki. Nikireki, nireki. Nireki, mureki. Mureki, nareki. Nikireki. Nireki. Nakireki. Mureki, nakireki. Nakireki. Nireki. Nikireki. Nireki, mureki. Can you focus on objects in your with your eyes? Like, is it hard for you to focus, like your pupil?
Always very hard. I
Or-
I I I I cannot read much anymore because the text message, those kind of like, I just cannot focus. My two eye cannot focus.
Okay, yeah, it's your this is your energy. So as of it's getting very, very hard for me to focus in on doing the healing here. It's like, and I see a pupil. When I close my eyes, there's a pupil. It's like it's almost like you don't have two pupils. You have one. This is what I'm getting. Like they're not both the same anymore. Like something happened in the surgery where you've lost the ability, they've kind of merged together to one pupil. Yeah.
I always feel my left eye. If you say lost pupil, maybe the left eye. I feel like everything wrong on my left side. My left eye, left cheek, there's like tooth, failed implant, and my left neck, my left back shoulder, my left hip, my left knee, my left
Mm.
ankle. Everything happened on my left side. I feel like just very imbalanced.
Yeah, there's some, I think he hit an artery or some sort, something. There was a misstep. It's possible he either hit a nerve or an artery, because I was getting neck arteries, but it's almost like a nerve. It's like a nerve or an artery. And it has, I'm only seeing you have usage of like one pupil. It's like there's just one, and it's very hard to focus because you still have the energetic signature of the other one that still wants to participate, but it's not able to. So it's like You can't focus because you don't even know what's going on with one part of you, but still that one part of you doesn't necessarily know that it's not able to use its own function. So there's a lot of confusion too, within this. It's all starting here in the eyes. He either hit a nerve or an artery. And this is connected to the neck and the brain as well. There's no filtration system. The body, subconscious is in the body. It's not, the neck is shut off, not able to bring the information up to filtrate out. We filtrate out. And do you dream at night?
Not anymore. I bought this PMF machine that will send out 1.0 megahertz frequency every night. So I push myself into deep sleep every night. So I think because the machine forced me to be in the deep sleep at night, I seldom have dream. If I do, I won't even remember.
Yeah, it won't force you. It will never get rid of your dreams. Actually, if we are in a very rested deep sleep, then we should be dreaming. That's another thing. Me working with the subconscious mind, being a clinical hypnotherapist, your dreams is how we filter. This is how we protect our brain. We have to be able to filter out some of those message units that we're getting in information all day. You're taking in information through your eyes, through your five senses, through just your environment. And when we get overloaded, the subconscious mind is what we able to dump back some of those memories, some of those message units. And that actually helps. It's a huge filtration system. But your neck artery is cut off from the eye, from the brain. So the information is just getting stuck in pockets of you. It's not able to filtrate. This is the issue I'm seeing. But he either hit a nerve or an artery of something he did. Do you have anything to add to that, Kia?
No, that's correct. You're right on. You're right on point with that. I'm just doing a little bit of research on all of that, and
Sure.
it just
Yeah.
aligns with everything that she's experiencing from that surgery. Something happened there that, kind of didn't go exactly right.
And I think this is why the mucus is forming, because it's kind of cut off, the filtration, in the body. And I think this is why I see a lot of mucus on the brain and in the eyes. It's causing a lot of the fog. Like if you feel like you have foggy eyes or a film over your eyes, that's mucus. So just getting that mucus, really leaning into your diet. And even if you could go to, it doesn't have to be the Ushu village. It could be, another facility that they do this. I know they have like North Star here. They have a few in the US, but they're all over the world. The herbs, you need herbs. You have to have herbs to get rid of, you can get rid of this mucus on an alkaline diet. You can. This is going to help you. I do believe it's going to help some, because the mucus is clogging brain fog. It'll at least get rid of your brain fog and help your eyesight a little bit. At least get that film from over your eyes. I feel that that's going to do you, so good. And it's going to be a process. You might be on this diet for a while. This lifestyle actually is a lifestyle, but you're going to start feeling better. So that is the light that I am seeing for you. I'm seeing you could gain a lot of this back by actually healing on a cellular level. I mean, but I'm seeing you may have to go to a facility, or you need to get the herbs from that facility and literally do everything spotless, and I do believe you can get that mucus, and you can gain back some of your memory and some of the sight. But this surgery is what has caused this disconnection between neck, eye, and brain.
And I also want to know, I had the failed implant. I saw a biodentist probably 5 years ago, but never had good luck on that tooth. it's right now it's I have to put in the bridge, and I feel like that cause problem all the way down my left side neck, and also at certain part of my life, I feel like my breast, left side breast, I feel pain. I feel like it's a kind of infection, just all this on the left side. I
It's
feel like
affecting everything. Yes, it is. It's affecting everything on this side, and sometimes lack of oxygen too during that procedure can cause issues as well. That's what I'm
Yeah,
researching here. So I
yeah,
just feel like that's a major, major issue and related to your memory loss.
yeah. I would like to go in and let's see if we can put some healing energies on that side of her body, starting from
Absolutely,
here,
absolutely.
starting from the
Yep, I
left
already
part of the
started
brain.
clearing out. Sure.
Hmm. Okay.
All right.
All right. Let's go ahead and relax and take another deep breath in. Would you please? Raising the frequency, the vibration in your body. And I want you to walk this energy down the left side of you on you when you exhale. Just move it out of the left part of your brain. 5, deeper. 4, deeper. 3, deeper. 2, 1. And just go ahead and relax. And yeah, hey, I also heard cranial consumption early on. I forgot about it, but I just heard cranial consumption. I'm not sure what that is, but I'm not sure if that's the mucus sitting on the brain, but let's take a look into that too. Mureki, nireki, nireki, bureki, nareki, nareki, bureki, nireki, bureki, nireki, nireki, bureki, bureki, nareki, rereki, bureki, nareki, nireki, bureki, nireki, mureki, mureke, mureke, mureki, nareki, bureki, bureki, nareki, mureki. Bureki nireki, nireki bureki, mureki, mureki bureki, bureki nireki, bureki nareki, mureki, mureki nakireki, dureki, bureki nareki, nireki, rireki, bureki nakireki, nireki, nireki bureki, bureki nireki, nireki bureki nareki, nikireki, nireki bureki, nireki, nireki, bureki nakireki, nakireki nireki, nireki bureki, bureki nireki, nireki bureki, nikireki, bureki nakireki, nikireki bureki, nireki bureki, bureki nereki, nareki bureki, bureki nareki bureki, bureki nakireki, bukireki, nireki nireki, nireki nireki, nireki nireki nireki, bureki nakireki, nireki nireki, nikireki, nikireki, nireki bureki, bureki nereki, nareki, bureki, nareki, nareki, nireki, 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 mureki, nareki, nireki, nareki, bureki, bureki, nikireki, mu, nireki, bureki, na, mureki, nireki, nireki, nareki, bureki, ni, da, mureki, na, nireki, 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 bureki, bureki, nireki, na, nireki, nireki, nare, bureki, nireki, nireki, nikireki, mureki, nireki, nireki, mureki, nakireki, nakireki, nireki, nireki, bureki, nakireki, nireki, bureki, nireki, bureki, bureki, nareki, nireki, 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 bureki, nareki, nareki, nireki, nireki, nikireki, nikireki, nireki, bureki, bureki, nireki, nireki, bureki, nireki, nakireki, nireki, nireki, bureki, bureki, nireki, 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 nikireki, bureki, bureki, nakireki, bukreki, nireki, Nireke, mureke, nakireke, nireke, mureke, nireke, nireke, mukireke, nireke, nireke, mureke, nireke, 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 mukireke, nireke, mukireke, nireke, nireke, mureke, nireke, mureke, nireke, nireke, mureke, nareke, nareke, mureke, 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 nareke, nireke, 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 mureke, nireke, mureke, nikereke, nareke, mureke, nireke, mukireke, mukreke, nireke, 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 mureke, nareke, nireke, 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 mureke, nareke, mureke, nireke, nireke, mureke, nareke, nireke, 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 mureke, nireke, nareke, nikereke, nareke, nireke, mureke, derereshke, derereke, 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 nireke, nireke, mureke, nireke, mureke, nireke, derereshke, derereke, mureke, mureke, derereshke, derereke, 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 derereshke, 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 direke, direke, dikereke, dareke, dareke, nireke, 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 nikereke, nireke, mureke, nireke, nireke, nareke, nireke, nireke, nareke, nikireke, nakireke, nakireke, nireke, nakireke, nireke, nikireke, nikireke, nireke, nireke, nakireke, nireke, nikireke, nireke, 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 nikireke, nikireke, mureke.
It's like a flap. So this covering, that mucus membrane over
Yeah.
her
Mm-hmm.
her
Yeah.
her brain, there's some kind of flap back
Yeah.
here like this. So I was just kind of like going in
I
and
was
just
doing this.
like from the side. Oh, really?
I was doing it from this way up to the back, and that's when I
Oh,
got the
really?
flap. Yeah, I was doing mine this
I
way.
was
Yeah.
okay. Perfect. So I was just kind of going in on the sides. And it's like,
I-
and it's soft here, like a mucus, like you said to here.
Yeah.
But here it's like plaque. It's like really, really tough plaque. It's more dry, but in the back is more like a soft film.
Yeah. I
So I fully cleared it, but
I
I'm
think,
wondering how far back did you get on your procedure?
yeah, it's a
Did
lot
you
of
go all
layers.
the way?
It's thick. I went back there where you said the flap was. So um
Mm-hmm.
but it's there's also too underneath that I'm seeing there's another covering. It's not thick like the mucus, but
Mm-mm.
I feel that I almost feel as if we need to. I mean, obviously we can't do it all today because the time is running out. But that mucus part did come out. I feel like we need to, it's almost like
It
the psychic
it
surgery that needs to be done, where
yep,
we go in and
absolutely.
really concentrate, because it all started here was the under the eyes. I
I
kept
felt,
going.
yep,
This one was
as we were
radiating.
removing this, yes, the eye was just pulsating, pulsating, pulsating. So it's directly related. It's directly related to that procedure
Yeah,
because
yeah,
it started to stimulate a little
yeah.
bit, but I feel like we can go more.
There has to be,
But
it's a
there's
lot of
just
layers.
heavy plaque on these sides.
Just like
Hmm.
this is all the layers that we got to go through. It's
But the side of my
a
back
lot.
felt like a drainage on the left side of my back side. I felt kind of like a stimulation also. So I felt a stimulation here in my eye and then all the way
Yeah,
down my back as we were chipping away.
I think we could
So
do
it's gonna
this. Like,
correct a lot. I
I
think
think we
so
just need
too.
more
And I
sessions
can
or,
breathe now too. Hmm.
yeah. How are you feeling, Julie? How are you feeling?
I I feel like a better. I don't know whether this.
Yeah, yeah,
You should
yeah.
be feeling
I
really
feel
good. Hmm.
Yeah, there's
That
more
was
layers to go. This is what I'm seeing. I think maybe we got that top mucus layer off. I'm getting 1, 2, 3 more layers is what that picture has, the very early on. It's all connected. Um, it's all connected.
First portion, this could have
Yeah,
easily been a 4-hour session today, right, Tahira? So this was,
yeah, if we had time.
I feel really clear here, and we know where to start next time as well, but you should feel the left side of your body should feel a lot better. Your allergies should start already feeling better. And this eye is gonna start, getting stimulation there, some blood flow there now, and starting the healing process.
Yeah, yeah,
So
3 more
that's
layers,
good.
3
By
3 more
next week,
layers to go.
mhm, 3 more layers to
Awesome.
go, but this was wonderful. You did great, Julie.
Yeah,
Thank
Thank you.
you.
did so
You did
well.
great.
One thing I want to add, originally I wanted to do it because I have a bad relationship with my son. And I don't want him to hear it. And so food. Um, I know people, have this people have this experience after they had the virus or cold,
Mhm,
they lost their taste. I
mhm.
don't know, maybe some part in my life I had some kind of illness. I got really bad cold. I don't know. Maybe that caused me losing smell. I used to be able to have very good smell. I can smell the rain, smell the snow. I very good smell, but I don't have that anymore. I think that also closely associated with my memory. Once you lost smell, you don't really feel life is that enjoyable. Food not good, just like I don't even know the meaning of living. You cannot feel like
Absolutely.
things that you really
Absolutely.
enjoy. You cannot really smell the good flowers, good food. Like flower, I have to be super close to smell the flower. So just
That has to do with the brain injury. It affected somewhere in your brain. It's almost like when people like hit their head really hard and suffer from brain injuries, this can take away the smell as well. So, and the taste, and then some other things kind of catalyst from that. So that's why we need to do this removal, because it's affecting all of that, your taste, your smell, your vision, your pain,
mhm.
um, your memory. We really do need to do this work. And thank you for scheduling that, because we really do need to go in all 3 layers and
Yeah,
This is
get
my
you
own
back
problem.
living
Yeah.
your life
yeah,
again and fix your
yeah.
relationship with your son.
Yeah, and another thing with your son, and I don't really want to say because it's on the recording, but we can do surrogate work. So your son doesn't actually have to partake in
Mhm,
it. You could stand in
mhm,
for him, and we can do the
mhm.
healing work that way. We've done that in several other
Through
sessions.
you.
So don't ever
Mhm.
feel that, oh, this person will not cooperate. But as long as we are edifying and we're not going against his free will, we will be able to heal, what's going on with you guys. So after we take care of your session, we can look into doing that one, okay? But this is very important what you're going through, okay? So we'll see you
Yeah.
back here for the 3-hour session next Saturday. And just get a lot of rest, continue on your diet. I'm so happy when you guys actually take this
Mhm,
information and start implementing it. Keep fueling your body, and look for that Dr. Sabi's list of his food list. Is the
mhm,
alkaline list, and please start eating an alkaline diet, okay? No
mhm.
dairy, no cheese. Just follow exactly the only foods on that list, because we really need to, that will help this mucus too as well, okay?
Another question,
Mhm.
people are saying because Earth is ascending, if I try to go higher frequency, I need to, leave my family because I do have living with my mom and dad, my son, low frequency people. If that's the truth, how can I leave my family? I mean, if I want to get better, is that true or there's a way?
You can live, and you can navigate yourself while living with your family. You don't have to leave your family, but you are energetically going to be able to navigate your family now. So they
Yeah.
won't affect you. If they are
Mhm.
affecting you in any way, lowering your vibration, you're going to be able to navigate through the low
Yeah.
vibrations easily. It won't affect your living
Yeah.
situation.
Yeah. Yeah, so
Okay.
it's really about fortifying yourself. I mean, we have to be around
Yeah.
lower vibrational people, and lower vibrational
Yeah.
people doesn't always need to sound like a bad thing, because we're all on different fields of energy. We're all on different grids, right? It's just that you are, it's your moment in time to actually vibrate at a
Mhm.
higher frequency. And I have to be around low energy people all the time. It doesn't mean that I don't love them,
Mhm.
but I respect my peace and, you know, my ascension above all
Mhm.
things, and I do put that first, even if I have to be around it. And when I know when I've received too many of their energy, and I excuse myself, you know, and I go and I
Mhm.
recharge myself. So just fortifying your own self with your own like spiritual practices and things that you do, just taking breaks from it. If it gets too negative, just go in the other room and recenter yourself. But no, you don't have to leave your family. No, because they need you. They
Mhm.
actually need you, because you're going to be the one, once you're fully healed, you're going to be the one to actually
Mhm.
energetically help them as well. Okay.
Okay. Great.
Mhm.
Awesome. Well, I will
Really
see you
One
next
appreciate.
more
week.
quick, quick aftercare. Your mouth, make sure to keep your mouth really clean. If you have one of those tongue scrapers, or you get like an herbal mouthwash, I feel like this is really gonna help. It's gonna help to stimulate. I'm just feeling a lot of activity in the mouth. Um, so I know
Yeah.
that really is gonna help you bring back that taste as well as we do this work. So that's something that you can
Yeah.
do on your side while we do the energy work, okay?
I also, because I had the failed implant, I constantly having pain here. Eventually, I did coconut
Um,
oil pulling a lot of other stuff. None of them really work, but I start using this red light and blue light therapy device put into your mouthpiece.
mhm,
They have blue light
mm,
and the red light therapy. I used it for probably a couple months. And a couple of days ago, I went to see my dentist. He said my teeth very well. This is first time in my life that dentist praised me for taking good care of
oh, that's
my teeth.
amazing. Because
Always
it
so
kills
careful.
bacteria. Because it kills bacteria. I'm feeling a lot of bacteria in the mouth. So also too, you know what you can do that's really easy? Just buy some peroxide, hydrogen
Mm.
peroxide.
Mhm.
And in your cup in the morning when you wake up, just put water in your cup and just put a drop, like a splash, like put it in the little cap. And then you can splash it in your water and wash your mouth out with that, with just a little bit of hydrogen peroxide in there. That's going to help also. You can even splash that on your face too, but I feel like it's just the mouth. The mouth, I'm feeling a lot of bacteria there. So, yeah, keep doing the red light and hydrogen peroxide wash. Okay.
Thank you so
All
much.
right. Thank
You're very
you.
Thank you,
Thank
welcome.
you. You're
girl.
very
Thank you, my
welcome.
dear. We will see you soon,
I'm
okay?
looking forward. I'll look
Yeah,
forward to seeing you again on Saturday. Have a
Okay.
great
great.
week. Okay.
Thank you.
Bye.
Bye-bye.
Thank you. Appreciate it.
Bye. You're welcome. Bye.